So our solution has been to embrace radical collaboration to protect community health workers. And this has been seen through a shift from the traditional approach where organizations have been viciously guarding their pursuits to one where organizations welcome deep collaboration. As highlighted by Madeline, under the CAF-Africa initiative, 30 organizations spanning 24 countries in sub-Saharan Africa have come together to cooperate in establishing a supply chain operation to deliver PPE to the last mile as part of a coordinated emergency response effort. I want to go over 3 strategies that have been important in this work. We knew that in order to mobilize resources, we had to accurately quantify what was needed to protect community health workers. We hear over and over again that we needed 448 million pieces of PPE, and to achieve this figure, we undertook a joint determination of need. This included 1, a quantification and a gap analysis. And to achieve a broad buy-in to allow organizations to rally behind the quantification, we used a participatory approach that recognized national systems, that recognized national structures established to focus for medical commodities within the ministries of health. And so we worked jointly with several organizations who work under the Community Health Impact Coalition and the Community Health Acceleration Partnership across the 24 countries to support the ministries of health in inputting assumptions related to community health workers, the number of community health workers serving in different locations, the type of PPE that was required to provide the services that they were authorized to do. And it was very important for us to ensure that this quantification was done under the ambits of existing structures and mechanisms, because we want to ensure that this effort adopts a system strengthening approach in a way that where a system to focus for community health workers does not exist, we contribute to establishing it. Where a system exists to focus for community health workers, we provide additional technical support that ensures that the community health workers are recognized, included in supply planning and the following budgeting processes. And through this process, we have been able to see that a number of ministries of health across the 24 countries are now more aware of the number of community health workers working on different projects in the geographies that they provide. They are prioritizing community health worker interventions in that they are including in supply planning processes, last mile logistics, all the elements that are required to receive and deploy items to the community health workers as needed. So we recognize that community health workers need to be protected now, but they also need to be protected into the future. This is a long-term thing. This is not a stopgap measure to just protect them now and vanish once the emergency is gone. And so we are looking at the processes, working with the ministers of health with a long-term focus, and that's why we are following a systematic approach. And in a big way, this initiative is allowed for the ministries of health to see that community health workers are important and must be integrated into planning and budgeting. To allow for us to create efficiencies that traditionally are missed by many players in the sector around procuring at competitive prices, procuring in large quantities, we established a pooled procurement mechanism leveraging on the competencies and expertise of direct relief. And so a number of the orders that different partners were meant to be procuring on their own on a non-competitive basis were pulled together, leveraged on an order platform created by direct relief. And this has seen us, I'm saying this because we've benchmarked the prices that have been achieved by direct relief with what is being achieved by other partners. So we're getting competitive price, we're getting competitive delivery times, and this has been very good in creating the efficiencies and effectiveness that are required in this initiative. I like this slide for one thing. The graphic here gives a full story about how we have many players in this sector who would ordinarily be competing in the geography, coming together under one voice to work with an entity that has the capability to procure across 3 continents, to arrange the first mile logistics related to whether it's air shipments, ocean shipments, and delivering them to the points of entry across the 24 countries. We've worked with in-country partners to support the Ministry of Health in supporting middle mile logistics, customs clearance, staging and storing the items at the central medical stores, and repacking the commodities into kits and delivering them into the last mile. So this whole coordination, this whole cooperation amongst the stakeholders across many geographies really points to a radically collaborative mechanism which has a capacity to continue benefiting community health workers and elevating and prioritizing them into the near future. Thank you.